Welcome to The Fold. My name's Catherine Kalinowski, and I'll be your host today. It's a distinct pleasure to be joined by Tom Cooper, Director of the Hamilton Roundtable for Poverty Reduction today. At Good Shepherd, we witness daily the impact of poverty on individuals, on families, and on communities. Thank you, Tom, for joining us today to talk about the work of the Roundtable, why it's important for organizations to work together, and how we can, as individuals, contribute to efforts to reduce poverty. Welcome to The Fold.
Thanks, Catherine. It's great to be here.
It's great to see you, Tom. We have worked together for quite a long time on all kinds of initiatives, and that's a wonderful thing. The downside is we're still working on many of the issues that we've been striving to make headway on for many years.
Yep.
For listeners who might not be familiar with the work of the Hamilton Roundtable for Poverty, can you tell us about the organization's mission and membership?
Yeah, the Roundtable was established in 2005, so it's over 20 years old now. And really, it started out as a way to tackle child poverty in Hamilton. And so there was a report from our local social planning and research council that indicated at that time Hamilton had the second highest child poverty rate in the province of Ontario. And council wanted something done. And so Joanne Pryal, who is general manager of community services for the city, got together with Carolyn Milne, who was CEO of Hamilton Community Foundation at that time. And they decided to bring together a group of leaders in Hamilton who would look at poverty a little bit differently. Now, we knew there were already amazing organizations out there like Good Shepherd dealing with some of the day-to-day crises that people face when they're experiencing poverty. The thought was to create a roundtable that could look at some of the systemic issues and do some of that upstream advocacy. And so the roundtable brought together leaders from the business community, from nonprofit organizations, from academia, labor, individuals who experienced poverty as well. And at first, their voices weren't quite as robust, I think, as we would have liked. But over the years, people with lived experience have really driven the priorities of the Roundtable. They now represent at least 50% of our table. And when we look at some of the policy issues, we've gone after fair social assistance rates, living wages, really trying to break down some of those ugly stereotypes that exist about people who experience poverty. It's really those voices of lived experience that come to the fore, and they're really the priority for our work.
It's interesting you talk about sort of a multi-sectoral approach as the foundation for the Roundtable, but you also talk about people with lived experience, and it's something that has impressed and inspired me over the years. That notion of nothing for us without us is really important, something we try and embrace at Good Shepherd with our own sort of formalized lived experience advisories and consultations and so on. And really, I think, a tremendous gift to the community that people who are sometimes struggling to survive, quite literally, are lending their voices to this really important issue. And the Roundtable, I think, is a model of how to do that effectively and a truly inclusive and respectful way.
Yeah, we try to. And recognizing that experience, I think, is really critical when you're developing priorities for organizations. So yeah, I've seen it working in action at Good Shepherd, and we've tried to embrace that idea as well. And it is absolutely critical.
And there are people on the Roundtable who many of us have worked with over the years and who we look to, I certainly look to as experts. I look for their opinion, their guidance when we're making decisions about development and policy and that sort of thing.
For sure.
So I think that's one of the unexpected gifts that the poverty has given this community.
Yeah, we were, just before the podcast started, we were reminiscing about our mutual friend, Lance Stingman, who sadly passed away last year, but Lance was certainly somebody with a lot of experience, particularly looking at some of the challenges around mental health and disability. And he was a tremendous advocate for people living in Hamilton's residential care facilities, a population that, as you know, is often forgotten when it comes to policy choices.
Absolutely.
Yeah. So folks like Lance and so many others have been absolutely critical in throughout multiple organizations in the city.
I think that involvement, as we get into this conversation, it's important to remember when we talk about how to make change. So you reference some of the dominant thinking around poverty, and there's a persistent theme in discussions of poverty that suggests that the issue reflects personal failures or limitations of people who are living in poverty. How do you reframe that kind of thinking? What do we need to understand about why poverty exists in Ontario and, in fact, Canada?
Yeah, there, but for the grace of God go I think. And certainly we know systemic choices, policy choices by various levels of government over the years have led to increasing inequality in our society. And nowhere is that more evident, I think, today than in Ontario's provincial social assistance rates. And if you look at Ontario Works, for example, $733 a month for folks to live on, to purchase food, to pay the rent, to participate in any type of social activity is just impossible. And those rates have been frozen for 8 years. And although we've seen ODSP rates, which is the companion program for social assistance for people with disabilities, it's been increased by cost of living. It's still nowhere near enough, as we've seen huge spikes in rent, increases in groceries. And so we often look at income as really the foundational piece for people. And if we don't have enough income flowing to people, they are going to fall into situations of poverty and desperation. And that's what we're trying to avoid. But it's been a tremendous battle trying to get governments and the public as well to understand that it is a matter of income. That's one of the reasons we were so excited a number of years back when the previous provincial government started the Ontario Basic Income Pilot. And here in Hamilton, 1,000 people participated, and I witnessed lives transformed overnight. People were able to stabilize housing. They were able to purchase healthy food. They were out in the community volunteering. They began to dream again. They began to think about their future. And that was yanked away from them by a political decision. But I think the lessons remain with us. And we've worked with researchers and advocates here in Ontario, across the country, and internationally to try to share those lessons and just how powerful basic income was for people.
Yeah, I have to agree. I was privileged to meet with and know a number of people who participated in the pilot, and it was transformational. It is transformational social policy. And in 2018, I think, as you said, the pilot was prematurely ended, and the learnings that were drawn from that were virtually discarded, not by all of us, but by some.
We were thrilled that we were able to work with a team of researchers at McMaster University who did survey more than 200 pilot participants here in Hamilton, and they found to a person that people were better off, particularly when you looked at some of those metrics around well-being and health. Yeah. People were feeling better. They were visiting their doctor less. And we know people who are experiencing poverty are far more likely to get sick, have chronic disease, have mental health challenges. And that's a huge burden on our healthcare system. It's a huge burden on taxpayers. And if we can solve some of those issues upstream, we'll pay less for them downstream.
Absolutely. It's interesting when you talk about the Ontario Works rate, for example, of $730 a month with average rents topping $1,000 a month for even a small apartment in this community. Yep. It is people on Ontario Works are assigned to poverty, and the critical humanitarian crisis of homelessness that we're seeing in this community is directly related to those social assistance rates. It's not about folks needing to pull themselves up by their bootstraps. Yeah. The math doesn't math in this case.
Exactly. And I found, and this is probably the same for your experience, Catherine, people who are experiencing poverty are some of the best budgeters out there.
Yes.
They have no choice. They have to make their pennies stretch as far as they can. And so I often hear, well, we need better money management courses. And for It's not about that. It's if you don't have enough money to start with, it makes it impossible to make ends meet.
Absolutely the case. And so we have a whole range of social programs that respond, food banks and hot meal programs, emergency shelters, case management programs. All of these are incredibly important and I think do help people survive. I would hope in our community we'd be aspiring to more than people surviving.
Yeah.
And I would agree with you that being poor is really, really hard work, really hard work. So it also flies in the face of that stereotype of someone who just doesn't want to get a job or just can't be bothered.
Exactly.
Absolutely the case. Having said that then, what do you think are the longer term needs? What do we need to be advocating for? What do you want to action? Obviously, an increase in social assistance rates, but that's not the whole story.
No, because at the end of the day, I do believe that social assistance here in Ontario is kind of an antiquated system. It's a 20th century design that's not working in the 21st century, given the way the workplace is now, people having multiple jobs, moving from career to career. I really do think we need foundational income supports, and I think that comes with basic income. We've learned from our experience here in Ontario that it can work, even during the pandemic when people were locked out of the workplace because of the danger to their health. There was a lot of concern about what people would do to pay the rent and purchase food. And so the federal government came out with CERB, the Canadian Emergency Relief Benefit. And that was kind of like a basic income program without a lot of the requirements. The way it was, I think, required to be paid back in some cases was a bit challenging. But I think it helped people maintain their housing. It kept people safe in a very precarious time. And so I think we should be looking at those models. And there's been basic income trials taking place all over the world, lots in the States and in various cities where progressive mayors have looked at various groups in society and thought that they might be able to benefit from a basic income. People experiencing homelessness in Vancouver have also received a basic income, and they were able to, save some of that money, put it towards a down payment on a new apartment, and a lot of them have stabilized their lives. So I think there's a lot to be said for implementing a basic income. And besides, we already have several basic income-like programs in Canada right now. For seniors, there's a guaranteed income supplement. For young families, there's the Canada Child Benefit, which came into force about 10 years ago and has really helped to reduce child poverty. We're seeing it spike back up again. For people with disabilities, there's the new Canada Disability Benefit. Now that's only $200 a month, and certainly nowhere near enough to help with the higher costs of somebody with a disability. But it's a start; it's a foot in the door, and ensuring that people can gain access to some of those benefits is really important.
Something that I often hear in my travels is people's belief that community members are electing to be on social assistance, that it's easy to get on, and that it's a great gig.
Yeah.
What do you say to that kind of thinking?
False. As you said, it's very hard being in poverty, and being on social assistance relegates you to the deepest poverty in society. $733 a month on Ontario Works, as we've talked about, when we know what people need in terms of looking at the market basket measure is 3 times higher than that to purchase rent and food and personal hygiene products and eke out any sort of social assistance. Social assistance is not a fun way to live. It's below subsistence levels of poverty. And unfortunately, I just don't think we've had enough public pressure on the government. And you're absolutely right. That's why we're seeing such increasing numbers in homelessness, in food bank use, because at the end of the day, the government, by legislating these poverty levels, are leaving it up to certainly well-meaning, kind people in communities to volunteer their time and volunteer their dollars to help, buttress the challenges that people are facing, but it's not a long-term solution.
No, it's absolutely not. And we have to look at the generational impacts. We know that children who grow up in low income and households impacted by poverty have chronic and acute health conditions at larger numbers. We know that it impacts progress in education and future prospects. So again, the business case for these kinds of income levels just doesn't make sense. I think the other thing I wanted to ask you about, Tom, is this idea that everybody who experiences poverty in our community and other communities doesn't work. Mm-hmm. They don't want employment, or they don't have employment, and that's why they need social assistance. Can you talk about that?
Yeah, a lot of them are working 3 jobs and still not making enough to pull themselves or their families out of poverty. They're part of our communities and our province's working poor population. And there's lots of folks out there. And again, it comes down to the way our economy is being restructured, the fact that, we don't have as many longer term careers as we used to. Particularly younger folks, younger people are, working 2 or 3 part-time jobs, and a lot of them aren't earning living wage. So living wage is something that reflects what workers need to earn at their job, not just to make ends meet and cover some of those essentials we've already talked about, but also participate in society. And here in Hamilton, our last living wage calculation was $22.60. And it changes from community to community as cost of living changes. So in Toronto, it's a little bit higher, but it's certainly reflective, I think, of what workers need to earn at their jobs, just as a bare minimum. That doesn't include, savings for retirement or education. It doesn't include debt repayment. It's just a bare bones budget at $22.60. Yeah.
Your work around living wage actually had direct impact on the operations of Good Shepherd. We're very proudly a living wage employer. I think especially given the work we do, it's essential that we say that out loud and that we honor that notion, because the calculation, as you've already referenced, for any employer says that their staff can pay their rent and feed their children and also actively participate in the life of community. We're not looking for subsistence for our communities. We're looking for thriving communities. And living wage is an incredibly important and not often discussed broadly. So it's an interesting idea to explore, I would say, for people in the for-profit sector, people who run businesses, to think about one of the actions they can take is to consider becoming a living wage employer, and supporting that movement, I think, is really important.
Absolutely. And we were thrilled when Good Shepherd came on board as at that time, and still, I think, Ontario's largest nonprofit living wage employer. And certainly, as you recognize, Catherine, in this sector, in the nonprofit sector, when government budgets are limited, it's really tough to pay employees a living wage, and some organizations find it very difficult to do so. So I'm thrilled that Good Shepherd has kept up that fight and continues to talk about the value of it.
Absolutely. You mentioned when we spoke earlier about a conference that's coming up in Toronto this summer about basic income. Can you talk a little bit about that and what you anticipate the results or actions that might come out of that gathering?
Yeah, it's really interesting. We're hosting the Basic Income Earth Network Congress in Toronto in just in mid-August, and the opportunity is to bring together researchers and advocates, government officials, and critically people with lived experience of poverty together to talk about the way basic income is being discussed in various countries around the world, some of the experiments that are continuing to go on, and looking at sharing collective action on how to move things forward. And we were thrilled that we had this opportunity to host in Toronto. It was initially going to go to the United States, but there were some folks uncomfortable traveling to the U.S. for various reasons that we won't go into today. But we were happy to step up and host this organization. So there'll be lots of workshops, lots of plenaries. A number of authors who've written books on basic income will be attending and talking about their perspective. And it's really a gathering where we can share successes and challenges. And one of the important pieces of it as well is we're bringing together Canadian basic income advocates the day before the Congress starts to talk about the future of the movement here in Canada, because there has been some interesting progress since the Ontario basic income pilot was canceled. There's been a movement in Prince Edward Island to run a demonstration project, for instance. There's been some really cool things happening in Newfoundland and Labrador, where the government there, the provincial government there, has moved people between the age of 60 and 65 off social assistance and given them more of a basic income, sort of in that transition phase before they get CPP. So there's lots of interesting things. There's a really terrific senator, Senator Kim Pate, who's been advocating for basic income in the Senate. She has a bill for a guaranteed livable income. Leah Gazan, who's a member of Parliament from Winnipeg, has been doing the same thing in the House of Commons. So yeah, there's a lot of interesting focus on it right now.
That's an interesting takeoff point when you consider that we have not only a municipal election coming up in Hamilton, but we have provincial election coming up, and perhaps a topic that people want to ask candidates about, where they stand and what they can do and what they're proposing for the future.
For sure. And one of the other interesting facets of basic income right now, and it sort of relates to our earlier conversation about work and living wage as well, is as we see more automation in the workplace, and particularly as AI comes into the workplace in new and unexpected ways, how is that going to impact people's jobs and people's incomes? And so I think as we, AI provides an opportunity, I think some would say, but there's also a lot of danger there too. Yeah. And so how we approach that and ensuring that people do have a solid financial foundation in the event that AI is more disruptive than maybe some people might think.
Yeah, we live in a dynamic landscape and things do shift and change. And you started out saying it could be anybody who experiences poverty and is really living on the edge or in fact off the edge. Yeah. And I think sometimes there's a ill-conceived understanding that when you talk about basic income, you're talking about wanting people not to be employed. Yeah. It also occurs to me, and you've referenced this, that any one of us might need the safety net to catch us, and the current safety net you're describing is not catching those who are falling into it.
They're falling right through it.
And that any one of us might need it. But also that, and I certainly am acutely aware of this after many years at Good Shepherd, when people's lives take a detour and they're in crisis, getting back on the road really depends on having enough resources to get back on the road. Absolutely. So if you're poor and you can't afford to do your laundry, or you don't have a roof over your head, or you haven't eaten for a couple of days, it's very difficult to get back into the mainstream and get back to doing what you need to be doing. So I think that we talk about policy and systemic change, and we have to do that with a lens of compassion, because as you've referenced, the impact on people health-wise and in terms of their self-esteem and the way they're perceived in their community is very, very important. Yeah. Not too long ago, the Tamarack Institute did sort of a 20-year retrospective of the Roundtable's 20-year journey. When you look back, what accomplishments are you most proud of? Are there some high points in that 20 years?
Yeah, I think our work with the previous provincial government on basic income was really transformational. I also like some of the opportunities we've been given around ensuring that people with poverty have a voice in the decisions that affect their lives, and so launching speakers bureaus, both a standalone one called Speak Now a number of years back, and then when the basic income pilot took off. We had one called Living Proof, and those folks were really able to share their stories right around the world with international media and at conferences, and really I think change perspectives about basic income. One of the other cool things I like talking about is some of our work tackling predatory payday lending. And we worked with the city of Hamilton to ensure that those storefront payday lenders that we see popping up all over town are a little bit limited in their ability to expand. So we brought in Canada's first payday licensing regiment, required them to pay a fee and post actual costs of borrowing, because we know, these are businesses that prey on people who are vulnerable, often people with limited income, and it often leads to a cycle of debt that makes it impossible to get out
Absolutely.
of. Yeah. So we've done some interesting work on that. Certainly the living wage work that we talked about has been cool. We launched the Ontario Living Wage Network from just here in Hamilton and with partners in Kitchener, Waterloo to now span more than 30 communities across the province and more than 1,000 employers. So it's there's a lot to point to, but certainly a lot more to do. And as long as social assistance rates remain woefully inadequate, we'll have to stay here and continue doing what we can to promote the idea that everybody deserves a livable income.
You started out today talking about the genesis of the Roundtable, and we talked a little bit about legacy. I wonder, 20 years on, has something shifted or changed in Hamilton's approach to addressing poverty?
Yeah, I think we're doing it in much more of a collaborative way than used to be the case. We tended to be, I think, siloed more, but now we develop partnerships. We work on projects together. We do podcasts together.
Yep.
And I think it's great that we can collaborate and coordinate our efforts as much as we can. And sometimes we come up with interesting ideas, but we're not able to move it forward. So another good example of this is the idea around ensuring people have access to tax benefits. So we knew lots of people in the community were not filing taxes, and so we partnered with a number of organizations, including the United Way and SPRC and the city, to set up free tax clinics for folks, and that has taken off tremendously. SPRC is running that program now, but it's returned more than $18 million to people in Hamilton who otherwise wouldn't have had that money.
That is such a legacy project. I have to say, I've had the privilege of seeing up close and personal the transformative impact of that work when people are receiving all of the funds they're eligible for.
Yep.
It means moving into adequate housing. It means that children go to school with full bellies. It means that people get back into the workforce, reunite with families. It's very, very real and impactful. And when you're living in survival mode, you don't necessarily have time to get or the wherewithal to get all the paperwork done. So having those helpers sort of uniting in the community is a game changer. That's an incredible piece of work. When we talk about the personal impacts and the cultural influences on poverty and the systemic dynamics that create and sustain poverty, it's pretty easy for people to become overwhelmed and sort of think, I can't influence this, I can't impact this. I'd be really interested to hear from your perspective what individuals can do, what community groups, grassroots groups can do, what businesses, what the for-profit sector can do to make genuine change, to drive change.
That's a big question, and I think there's multiple answers to it. The biggest thing is to get involved, and I think, and I want to give a little shout out to my aunt and uncle, Gloria and Roger, who've been volunteering at Good Shepherd for decades. And whether it's helping out at a food bank, whether it's writing to a member of parliament or provincial member of parliament to say you want a policy changed, whether it's attending a meeting, there's lots of opportunities. If it's a small business, paying a living wage to employees, recognizing that we need to step up a little bit to ensure that everybody has enough to live on. So I think there's multiple routes, but having the conversations are really important. I think we've, and John Stapleton, who's a provincial policy analyst, I think talked about this recently really well. He talked about the pixelization of poverty and, identified that, we're kind of, when we address poverty now, we're kind of working in silos as well, looking at homelessness, looking at emergency food use, looking at other issues. And at the end of the day, we need to, I think, bring ourselves together again and look at it in a holistic way. And I think a big piece of that is around income as well.
Absolutely. You're right. There's a real challenge there. Today we're talking about poverty on the podcast, how that intersects with health and housing and food security and education and all other kinds of things is really important to understand that these aren't isolated issues.
Yeah, exactly. And I was thinking of another issue when you had brought up children experiencing poverty earlier. We know lots of kids are living, kids aren't living in isolation. They're living in families, and some of those families are on social assistance. They're not getting anywhere near enough to live on it, and so they're being evicted, economically evicted, because they don't have enough money to pay rent. And so those kids are moving from apartment to apartment every 6 or 8 months, changing schools, uprooting themselves from their social lives at the schools, and that's having a tremendously negative impact on their future well-being as well. And so it's all circular, I think, when we look at the issues and all those quality of life measures, but the social determinants of health that we like to talk about, they're all connected.
They absolutely are. And you referenced this before, but if we want to, people often talk about the cost to taxpayers for social assistance and shelters and all kinds of programs like that. But the business case is investment upfront in people being able to live with dignity and above a subsistence level pays off hugely in terms of healthcare costs and other big systems costs. It's really not that complicated at the end of the day.
It's not. And many Canadians are quite supportive, I think, of the idea right now that the federal government needs to invest in big projects, and whether those are bridges or pipelines or airports or ports, whatever. But we need social infrastructure too. I would argue we need social infrastructure first, and ensuring people have enough income to live on, to thrive in society, will help us do those other things much, much better.
Tom Cooper, thank you for joining us today and for talking about this really important issue. And more importantly, thank you for the more than 2 decades of work you've devoted to trying to create a more compassionate community for everyone. Really appreciate it.
Thanks, Catherine. Great to be on.
Tom.